All right, welcome back to another episode of Help Healing Everyday Life Problems in a COVID-19 World, day 5.
Ah,
That is insane. I am Dr. Shana D. Lewis, one half of Beacon Institute. Let me introduce myself. I am a licensed professional counselor, a motivational speaker, an educator, a trainer. Yeah, I am just a servant, and I love serving in this way, helping to educate folks about mental health issues. And here is my trusty co-host.
Hi, everybody. I am Dr. Rochelle Whitaker, educational psychologist, mental health therapist, parent educator, author. And so I'm excited for tonight. It's our last night, but we have a lot in store for you guys talking about substance abuse. And so I am excited to hear what we have some men again tonight to hear what the men have to share with us.
Yes, those are always great nights. I guess day 2 was a man day, day
Mhm.
1, day 3, and day 4 were all about the ladies. And now we're going to bring up the rear, day 5, with a few more men folk that are going to help us get it together in this COVID-19 world. Now, what we did on Monday or Tuesday or whatever day we did, so day 2, we introduced why Beacon Institute is an organization, what we're here to do. So some of you may be joining us for the very first time right now and you haven't been with us all week. So let us just tell you a little bit about Beacon Institute. Dr. Whitaker and I are both licensed professional counselors, and we started practices around the same time a couple of years ago. Well, I say a few years ago. It
Okay,
seems like
a couple.
I know forever ago.
Mhm.
Yeah, who's counting though? I'm in this
Right.
thing for 2 years. She's very close to, I want to say maybe like 9 years in the private practice world, or very close to that because we went out around the same time. We used to work together. And so we figured out that, on our journeys, we wanted to be able to support each other as we were growing as clinicians in practice, but also wanting to educate the community. So Beacon Institute was our way of doing that. We came together to create this organization as an educational consultation platform for us to be able to share information with you. So there you have it. That's what Beacon Institute is all about. And just be on the lookout because we got a lot of other things that we want to share with you mental health wise for the public as we go. So I will get out of the way and let Dr. Whitaker do our introductions for tonight because I am looking forward to tonight's conversation. Um, Help, I need a happy hour.
All right, guys. So what we know is since the pandemic has started, alcohol sales have been up, right? Liquor stores were able to remain open during the pandemic for a plethora of reasons. And so we're going to talk about substance abuse, right? And so I think one of our guests or our experts, I think Dr. Oneill was saying, one of the things that we have to be concerned about is not just those maybe who are predisposed to substance abuse, and so also those in recovery, right? Because part of recovery is support, and right now we are social distancing, and so that might pose a challenge for those in recovery. And so our guest, who I'm going to introduce, will talk a little bit more about some solutions to what we can do for those in recovery, those who are predisposed, and those who are looking to self-medicate and need some other solutions. So we have Dr. John Oneill, who is the clinical director of Menninger Outpatient Services in Bel Air. He is a licensed clinical social worker and chemical dependency counselor, as well as a certified addiction therapist, sexual addiction, and critical incident stress debriefing counselor. His specialties include relationships based on attachment theory and family systems, substance use, gambling problems, the impact of addictions on professionals, including athletes, sexual help me with this word. Compulsive. No, that's not it. Okay, I'm going to go on to the next one. Technology overload and emotional stressors for executives and high functioning professionals. In addition to his work at Menninger, he manages the mental health program for Major League Baseball's professional umpire development program, teaches in 2 graduate programs, and previously spent 12 seasons managing the mental health program for the Houston Astros. So that's exciting. And then we have Dr. Chance Tran, who is the director of the Community Behavioral Health Department at the Council on Recovery. He is an administrator, licensed clinician, educator, and researcher with numerous publications and presentations on the local, state, and national levels. His focus is on addiction, trauma, crisis interventions, and diagnosis and treatment of co-occurring disorders. He is currently licensed and practicing in the state of Texas as a board-approved licensed professional counselor supervisor and a licensed chemical dependency counselor. He is also a board-approved national certified counselor. So, Dr. Shayna and our experts, y'all have the floor.
All right, here we go. Thank you for that, Dr. Whitaker. Let me get these menfolk on this stream so we can get this party started on a Friday night. Hello, hello, hello. How we doing this evening?
Doing all right.
Yes.
I'm trying to get over the menfolk thing, but okay.
It's like it's happening. We had 3 days of ladies and 2 days of men. So listen,
Menfolk, huh? Okay.
With the menfolk. So I'm so excited and glad that you guys are here with us tonight. Let me see. I'm trying to make sure I can get a good visual of everybody. So I'm looking forward to this conversation for multiple reasons. One, because I know both of you and have known both of you for many, many years. And I know you are very bright and you're going to share a whole lot of things that I know nothing about. I've been telling folks all week long, I bring people who are smarter than me on specific things because they're going to teach us all something tonight. So I'm looking forward to this conversation. So let's just start with the reason why we even brought up the substance abuse topic on our virtual summit this week was I kept seeing a whole lot of folks saying we're having these virtual happy hours. And so I'm like, well, so everybody's having a virtual happy hour. So that's on Friday? Well, not really. Those will happen like 5 days a week. And I began to question, and Dr. Whitaker and I talked about, so is substance abuse something that's on the rise? Is it a greater problem right now? What's the state of that? So that's why we said, well, let's bring experts on to help us answer some of those questions. So Dr. Oneill, what would you say, with all of where we are right now, what would you say is the state of substance abuse or use in our country, and how has COVID-19 actually impacted that, if at all?
Sure. Well, thanks again for having me on. I'll start off by saying I get it. I mean, we're at a time when we're under a lot of stress. We're all trying to figure out how to cope. Every one of us on this call, everybody, we're all trying to figure out how to cope. And when we try to figure out how to cope, we look for easy ways to do it. What's easier than getting a bottle of wine or 2 or 3 or 6 or whatever somebody might be drinking and having a few glasses and saying, hey, it's good. And by and large, for most people, it's not going to be a big deal. For most people, they're going to have a few glasses here and there and it'll be fine. But when that transitions into using more and more over longer periods of time for weeks, months at a time, then it can become problematic. And then when someone stops figuring out how to cope without alcohol or marijuana or other drugs or Xanax or whatever it is, they lose the ability to cope. And while I get it and I can see it and I understand it, and I think most people at the end of the day are like, it's wine o'clock and it's time for, I get it. I relate and I understand it. But we have to be very mindful that it can get out of control when people start to forget how to manage without it.
Got you. So that's important because it can become a coping mechanism. And we understand that you have coping mechanisms that are healthy and helpful. And then there's some that aren't so healthy or helpful. They work though, because in the moment you get numb, you don't have to deal with what's happening perhaps, but it doesn't fix the overall problem that we have. So definitely a coping mechanism. So Dr. Tran, what would you say when you think about the work that you do? I know you work with the council, and so you all day, that's all you guys do is work with folks that are in recovery all the time. What have you seen any trends changing in your work as relates to folks in substance abuse since COVID-19?
Absolutely. There are 2 major trends. First off, from the clinical side, we've had to change how we do work because of COVID-19, right? We used to see people face to face. We would have people show up at our front door, and we would have our clinicians screen them face to face. Because of COVID-19, we haven't been able to do that. So what we've done is we've gone remote, and we've been able to do telehealth for the city of Houston, for the Harris County. So that's something that we've had to do, and we've had to transition very quickly, just like most everyone else out there. Right? I'm sure that you had to do similar things. And the other side is going to be from the patient side or the client side. What we've noticed is that there has been an extreme uptick in need of services. I spoke to one of my lead clinicians a couple of days ago during a meeting, and we were having over 30 referrals every single day. And that's quite a bit of uptick, considering normally we would get about 50% of that. We would average about 50%.
Oh, wow.
So that's quite a bit of referrals just for one center, right? So I think people are using more. Clearly, the sales are showing that, and you really have to talk about this whole isolation thing, right? When people are isolated, there aren't too many things that they're able to do. And one thing people do very well when they're isolated is that they use drugs as a coping mechanism, as you said before.
Got you. So, wow, that is interesting. So you up 50% of referrals on a daily basis. Are those self-referrals? Are those coming from other sources? Are those just people just saying, hey, I need help?
These right here are from both. Some are from local agencies, some from hospitals, some from treatment centers, and some are self-referrals.
Okay. So Dr. Oneill, you work with the Menninger outpatient clinic, and I know your work is with clients all day long, every day as well too. Are you seeing any changes inside of your client usage of services? Are people seeking out services specifically as it relates maybe to substance abuse?
Absolutely. One of the problems, and I think we're going to continue to see this, is for a vulnerable population that's used to having recovery services available to them. That's not the case. So if you're someone, there's different populations. If you're someone trying to stay sober and you're used to going to meetings, 12-step meetings, smart recovery meetings, celebrate recovery meetings, I don't care what it is. You're not having those meetings in the same way and shape and form. And as an attachment guy, I know the value, like we all do, of the relationship. And while online meetings are wonderful and great, they're not the same. And it's not just the meeting part. It's the before the meeting. It's the after the meeting. It's the dinner. It's the coffee. It's all of the camaraderie that comes with it. And so we're seeing more clients who are struggling and desperate to find attachment and connections because that's what's helped keep them sober. And it's not easy to stay sober in isolation. I think what Dr. Tran is saying is right on. The isolation, the withdrawal, the aloneness that's happening. Even if you're with people, you're still feeling alone because oftentimes you're with people that aren't always in the same recovery boat you were in, or you're with people perhaps that are in the opposite extreme where they're not at all interested in being sober and you're trying to manage it. And the people that help keep you going are not available to you in the same way. You could Zoom call them all day, you can FaceTime them, you can do whatever, but they're not available in the same way. So my long-winded answer is absolutely we're seeing more of that. And we're seeing more desperation in terms of what do I do? How do I handle this? And that's not just the person struggling with substance use, that's the family. And the families are like, we discovered our adolescent using marijuana, or we discovered our adolescent using pills, opiates, Xanax, whatever, and we don't know what to do. And normally they would use a service like the council, they would use the treatment centers, and they would have easy access. They would be able to set up an intake, and we'd get them in. Everybody would get them in. We'd do a full family assessment, and we'd sit down and lay out recommendations. That's not as easy anymore. And so you can try to do it virtually and everything else, but you're also trying to contain the situation, whatever that might be, in terms of trying to help the family contain and develop safety. Now you might say, oh, it must be easy. Everybody's locked down. Not everybody's locked down. It's supposed to be in some ways, but I drove to my office today to pick up some things, and there was traffic.
So that meant everybody's clearly not locked down.
They were not locked down, and so we're not living in a true lockdown where adolescents are all at home locked away with their families, or where people can't get access. Keep in mind, essential services was a liquor store. That was classified as an essential service. A liquor store. All right. So for the first time in the history of Texas, we allow delivery of alcohol. That speaks to the culture and the need to use. And I get it. but it is a concern, and it should be a concern, something we should think about and go, wait a minute, right? I understand why, but I think we're going to continue, not just during this situation, when COVID-19 finally ends and we get some semblance of new normal, we're going to have some repercussions we're all going to have to deal with.
Oh, that is absolutely true. So if you're just tuning in, you are joining us on Healing Everyday Life Problems in a COVID-19 World. This is a virtual mental health summit. Tonight's topic is Help, I Need a Happy Hour. We're dealing with substance abuse. We have two experts here, Dr. Tran and Dr. John Oneill, who are sharing insights about substance abuse and how it's happening right now in the world that we're in. If you got questions, please put them in the chat box. Just say hello. Let us know that you're here and you're watching and where you're watching from. If you have any questions, feel free to ask them. Now, something you said, Dr. Oneill, that really resonates, because we talked about the whole idea that liquor stores were labeled as essential businesses. And so can you explain what made that? And you didn't make the rule, right? I understand that. But from what your understanding is, why is it considered? Why was it considered? Why was it even necessary to make it one of those businesses that was essential?
Well, and there's political stuff, and then there's also psychological stuff that comes along with it. And I think anytime we're in a pandemic, which obviously we haven't had this before, anytime we're in a crisis or anytime we're in a time of great trauma, we look for ways to cope and manage, right? And so our politicians, our leaders, everybody else says, well, let's make sure we make it as easy on everybody as possible. And so I think it wasn't going to be a real big issue at all until they said, well, wait a minute, we're going to deliver alcohol to your house. I mean, that part made me pause. Like, what?
Yeah.
So you can get a case of whatever, or you can get a big thing of margaritas and everything else. And I started having concerns about that. But I understand from a political and an emotional standpoint that people were looking for ways to cope. And I think the government kind of just says, well, let's give it to them. I mean, what the heck? And I have a theory, and I call it the zombie apocalypse theory. And that is, a lot of people in recovery wait for a zombie apocalypse. And their zombie apocalypse is their own personal apocalypse, whatever that might be. Job loss, relationship ending, medical problem, whatever else. And when they have their own personal zombie apocalypse, they give up recovery or they give up trying. And they say, what's the point of staying sober? My world's come crashing down.
Okay.
In some ways, we are all having our COVID apocalypse. And we're like, well, what's the point of eating well? What's the point of not drinking? Why don't I just eat whatever I want, drink whatever I want? Because look, the world's terrible right now. It's awful. It's hard to deal with and everything else. So I think from a leadership standpoint, the government says, well, let's just make sure we're handing them all the things they can do to cope at this time, and let's not make it harder on them. And then, there's other things, but that's kind of my take on it. Yeah,
I got you. And so, Dr. Tran, what would you say? Because you guys at your facility, you also do inpatient as well too as outpatient. And in my head, I'm wondering about what happens if somebody needs to detox right now in the middle of COVID-19. What does that look like? And if if alcohol was completely cut out and it was not essential and all of those states shut down, the withdrawal, the other things that could happen, then do we create a medical issue as well too on top of the COVID-19 issue? So from your perspective and the folks that you're working with, what does that look like?
Well, I'm slightly biased, obviously, because I work in this field, and I work with a lot of different doctors and a lot of different hospitals. And so I'm going to go ahead and say, if we had no more alcohol, things would be better off. Because people are still going to drink and they're still going to overdose on different kind of drugs. And so the hospitals are still going to have people. Plus, when people start using alcohol, for instance, when the bars opened up last week, people weren't social distancing. And so they're more likely to spread the virus, right? If I'm drunk and if I'm smoking, whatever I'm smoking, the likelihood of me being much closer to you is going to be very high. I'm not going to be worried about you. I'm not going to worry about me. I'm just going to be worried about having a good time. And so it actually makes it more difficult for hospitals to keep people safe if you have this influx of people using alcohol or other different kind of drugs. So that's kind of where I stand. I recognize that people may detox, but I think in the long term, and I think COVID thing, we've seen now that this is not a 1 or 2 week type of thing. It's not type of thing. This is a long-term issue. So in the long term, having people use less drug is going to be more helpful for that individual and for society as a whole.
Got you. And so that is, I mean, I think on any given day, that's still our goal, right? Is to help people be to live lives where they can be healthy. And obviously, you know, drinking is not an illegal thing, right? You can drink and do this in a healthy way where it doesn't negatively impact your world. Because I want to make sure we don't say that there are folks who can drink responsibly and it's not a problem for them. It doesn't become a problem for everybody, right? There are some who can drink. Now we're talking about substance abuse as a whole. Then you get into the illegal stuff. You got a whole nother set of stuff that goes with that, right? But if we look at usage of substances, would we say, and will you all tell me, because I don't know the numbers to this, the most highly used substance that is problematic is what? What would be the top 2 or 3 things that people are using right now that we count as problems?
Alcohol.
Absolutely.
Pound per pound.
Number 1.
Pound per pound, alcohol was without a doubt. You can take all the other drugs together, and alcohol, our legal drug, causes more damage, more destruction, more death, more financial burden, more. I mean, you got to take the psychosocial stuff in with it as well. You have to take all the impact on family, divorce, domestic violence, sexual assault. You have to put all of that into alcohol. In fact, when people talk about marijuana, they'll go, "Well, it's not. You know, it's not as bad as alcohol." Well, that's true, because alcohol's the most destructive of all substances. And although most people can drink alcohol responsibly just fine, it's that 10 to 12 to 15% fully embroiled in a disorder that causes all this destruction and damage. And part of the misnomer about being something legal is that legal equals safe. Guns are legal too, but I wouldn't call guns safe. You know, so we have to be careful with legal is safe and illegal is unsafe. That's not true. I mean, I'm not an advocate for legalization of marijuana, but marijuana, by and large, at least the older versions without the 90% THC levels, significantly safer than drinking alcohol for a lot of people. Now, I said that to somebody in a lecture once, and they're like, "You're saying marijuana's fine?" I said, "No, I'm calling alcohol the most destructive thing. And then I'm saying marijuana is less destructive. That doesn't make it non-destructive." It's amazing what people hear when they want to hear it, right? So, you know, so I would say the second thing I worry about is opioids.
Got it. Okay.
It's my second big worry, because we have more opiate overdoses every day, 135, 45, whatever it is now. I don't even know the numbers. And we don't have resources and services right now for people struggling with opiate use. And so one of my experiences recently has been that more and more doctors are just trying to get them through by prescribing more and more. That also means less oversight, less follow-up, and we have more people who are going to get prescriptions, and we're not going to have people who are able to actually follow up with them.
Oh, right. So can you give some examples of what these opioids are? Because folks may not realize what types of drugs those might be.
Hydrocodone, oxycodone, Vicodins, the big ones, tramadol, and then you have other things that are not opiates, but prescription drugs in general. Things that people might go, "Oh, that's no big deal. I'll use Soma." Soma's a muscle relaxant, but it can be highly abused. And so all kinds of prescription drugs. We also know that most adolescents who develop a prescription problem, or most people who develop a prescription problem, do so in their adolescent years. They have their first experience in their adolescent years. So if you're a 16 or 17-year-old at home right now, and mom and dad have a bottle of something, and you dip into it a little bit. And I can tell you that most people don't know what drugs they have in their house. So there's one thing that I can impress upon people tonight. It's know what prescription meds you have in your house. Treat them like a handgun. Lock them away, keep them away, take them away from anyone, because you may think it's a benign drug and it could be a highly abusable drug. So be careful with your prescription drugs.
Wow. That's good.
I'm lecturing a little bit, but
no, but I think that's important to mention. This the statistic of the first time folks are introduced to these drugs, more than likely they were in their teenage years, is very important for parents to understand. Because as a parent, you have a teenager and you're not aware of the possibilities, right? That they may be getting them from you because you got them in the cabinet. And maybe you got it from, I'm thinking as a parent, I had a surgery, I had some medicine that I got from that. I just stuck it up in the medicine cabinet, not thinking I may never go back to that again. But it's a
Well, I can tell you,
yeah.
I can tell you your teenager and your teenager's friends and other people will.
Yes.
Because, and in the research plays this out, 50 to 60% of all first-time prescription drug use comes from a family or friend.
Whoa.
Not a drug dealer, not the guy on the corner it's a family or friend.
Wow.
And it could be your grandparents.
Right.
It could be your aunts, your uncles. It
Wow.
could be a friend over at the house who just flips through your little medicine cabinet and sees, oh, look at this. This is hydrocodone. No big deal. 3 of them go in their pocket.
Boom. Just like that.
And you'll never know. You'll never know.
Never know. Because
Yeah.
I got stuff right now. Tylenol 4. I got a whole bunch of stuff from procedures or whatever. And if anything went missing in there, I would have no clue. You
better watch out. People are coming to your house later to get it. So
exactly. So what you just told me is I got to go get that medicine, dump it out because it's probably expired anyway, or lock it up somewhere. That's a great, great, great point. Being responsible with drugs in your home, even if they're prescribed, becomes your responsibility. I think that's very important.
I don't want to share you, Dr. Shayna, but another pretty scary statistic is that by the time your child enters the 12th grade, about 50% of them have used some kind of illicit drug, and about 10% are using them regularly. And so it's dangerous. But the good thing is that if we keep these drugs, we educate our children and we teach them about drugs and we keep them away until they graduate from college at 21, 22, the likelihood of them becoming addicts drop tremendously by 50 or 60%. And so we need to keep them safe at this time.
Wow. That is really good to know. Because here's the thing. We talked about the other night with Dr. Kate Walker about kids and parenting and the things to talk to your kids about. This is a thing right here to talk to your kids about. Like, this is a thing to have a conversation because they're going to be exposed. Whether it's for people you know or not, kids are going to expose each other to this stuff. So I'm glad we're talking about young people right now. That's really important. So when you think about from the parent perspective, so you have a parent at home, so maybe, you know, your kid, you were never concerned about them, but the kids are under a lot of duress right now. They are isolated. They don't have their friends. They, you know, or they're all virtual or what the case might be. They were graduating school last year into school was chaotic. It was, I call it anticlimactic because you didn't get the big boom in that you were hoping for. And so there's a lot of disappointment, a lot of sadness, a lot of anxiety about their future. So what are the likelihoods of our young people who are in this kind of distress being more likely to seek out these coping mechanisms of drugs, whether it's alcohol or something else? What as a parent do I need to be considering or thinking about when I'm talking about my teenage kids in the middle of this COVID-19 world?
The short answer is yes, absolutely. Absolutely. Kids are bored at home, and so they're going to be seeking things. Secondly, they're isolated. They're spending a lot of time in their room playing video games, on social media, on TV, and so we're spending a lot less time with them. The culture of our younger children now is going to be on social media more than face-to-face as an older generation, and so we're going to see them a lot less, and so they have the higher likelihood of being able to hide some of the symptoms of being on drugs and alcohol. And so it's going to be a lot easier for them to get away with using some of these things. And so as caregivers, as adults, as parents, we really need to spend a lot more time and energy paying attention to those people and those kids that are at the highest risk.
Wow, gotta pay attention to the kiddos. Dr. Oneill, what about, do you have kids that you see in your practice yourself as well? Teenagers and younger kids? What's the youngest age of child that you've treated that's been suffering from substance abuse issues?
Well, I don't usually treat anybody under 12 or 13. And so I've certainly over the years seen plenty of people as early as 12 or 13 who started to abuse substances. Sometimes they came in because they were vaping, they were using e-cigs. Then as you dig deeper, you find that there's other things going on too. I've had clients that have abused cough syrup. Here's the thing, when you're trying to feel better, you'll try anything. I had a client that used nutmeg, that looked it up and found out if you use enough nutmeg, you can get high. It takes a lot of nutmeg, by the way, so don't anybody go looking it up. You're not going to want to all that nutmeg. So nutmeg. Hey, look, from the dawn of time, people will find a way to feel better.
Yeah.
That's what we do. I mean, there were people that decided to lick toads. And when you have hallucinations. So somebody was licking a toad. So we have to keep in mind our adolescents, and I like what Dr. Tran was saying, that, you know, hey, the reality is they're not going to cope well right now. And we were talking about it a second ago. There's a lot of loss right now. If you're a senior in high school and you're graduating and you didn't have prom and you don't have a senior trip and you didn't have graduation and you didn't have the pomp and circumstance and you're at home and you're away from your friends mostly because some families, some aren't letting them hang out, you're going to look for a way to feel better. And when any of us have loss, we immediately try to find a way to deal with the loss. And I think most of adults, we can think about it. You think about a family member. What's one of the natural reactions that someone has? I need a drink. I need a drink. You know, I'm Irish. And so person, you go to an Irish funeral and an Irish wedding, they're kind of the same thing. Alcohol is a big part of it. You mourn through alcohol, you celebrate through alcohol. Well, you deal with loss through alcohol and other substances. And so we have to be particularly thoughtful and mindful about our adolescents and our vulnerable population, people that are already struggling with mental health concerns, who already have other issues. So
got you. Wow. So let's go there, because you brought up, you know, this what we call in the clinical world, you know, the comorbid kind of diagnoses that live together. And folks who are already predisposed to depressions or anxieties, already suffering with those things, couple that with a substance use issue, only makes whatever you were dealing with initially that much worse. So what does that really look like? Because we know there are many people right now that haven't been diagnosed with depression, anxiety, or even a substance use disorder, but they may have all of it at the same time right now. Like, this whole COVID-19 has been an ongoing trauma that we have all been in the midst of living through. And we were talking about this the other night. So many people have a lot of unresolved issues from their past that this on top of it just became a weight that was just too heavy, right? And so they may already been dealing with some depression, not treated, none of that at all, but then enter COVID-19. Now I have all of this to deal with. What do we say to those folks who may be dealing with multiple mental health issues or disorders at one time, and substance use is one of the ways that they're working to cope? What do we say? What do we want to tell them? What do we want them to think about?
Which one of us? Either of us?
Whoever wants to answer the question.
I'll jump in. What you're talking about, Dr. Lewis, is cumulative stress, right? We accumulate stress over time, and we've had loss, stress. Perhaps people are losing jobs, worried about their finances. And here are these addictions people talking about, well, don't drink and be smart, don't do this. That's a pretty tough message for people to swallow. Yeah. When your life is kind of crumbling around you, the last thing you're going to worry about is whether it's a little bit harmful to drink or do drugs or whatever. And we get that. The problem when you start to add in the losses and the trauma and depression and anxiety is things can deteriorate for you very rapidly. Yes. Emotionally, physically, and so on. And then you can get to a place where you're feeling pretty desperate. Yeah. And then I worry about things, and this is something we're seeing and going to be seeing more, and that's people feeling suicidal, people getting to a place where they feel like there's no point in going on anymore. And then there's violence towards others. I mean, there's a lot of scary things, and I'm not a big, chicken little head cut off, whatever, that everything's going to go to, what, but need to be thoughtful about that. That's a real concern when someone has a mental health problem or they're developing more and more of one, and they combine that with substance use. We know where that leads. We've seen that in the world of co-occurring, comorbid, diagnosed, whatever we've called it over the years. We understand that the synergy of those two conditions together over time, and the longer they're together over time and untreated, the worse the outcome is. And so that's where we really have to pay attention to, how do we help people? So the message I would say at the end is, this needs to be, if someone is suffering that way, they need to reach out. They need to reach out to people they trust, to family, to friends, to professionals. There are people that will help them.
Mm-hmm.
I mean, we're not all, this whole profession hasn't shut down.
Nope.
People are not, there are people here that are willing to help. It may look a little different.
Yeah.
It may be done through video conferencing. It may be done with masks. It may be done different ways, but there are people that are still doing this work.
Yes.
Still trying to help. And there are still people that will respond to them.
And the good news is that it's even more accessible now than it ever was before. We've been talking about that all week, that mental health counseling, therapy. You could do it in your car. You can do it sitting in the bed. You can do it wherever you want to in a virtual space. So it is absolutely accessible to you 100%. And so we were saying insurance companies before weren't paying for virtual therapy. Now they're like, do it because everybody who needs it needs to have access to it. So I'm glad you brought that up. You don't have to do this alone. And sometimes we decide that we just won't reach out for help because whether that's pride, whether that's I don't want anybody to know my business, I'm embarrassed, the stigma behind it or whatever it might be, the message is do seek the help, don't do it alone. Dr. Tran, we were talking earlier about some of the important things we wanted to make sure we brought up today. We were talking about reducing the immune system, the lungs, and that kind of thing as part of something important to address right now. Can you speak more about that?
Sure. Dr. Oneill brought up two different things. First thing was actually vaping. The second thing was opiates. And the one thing that we know now from medical professionals is that the coronavirus works on the lungs. And what basically the coronavirus does is it's basically an extreme version of pneumonia where your lungs fill up and it makes it harder, if not impossible, to breathe. And so when you use different type of drugs that you inhale, like vaping, for instance, you're damaging your lungs and making it more difficult for you to breathe. And so that greatly intensifies the risk of using that type of drug. I mean, people might say, I'm only smoking cigarettes, I'm only vaping, it's pretty safe, but not in this time. The second thing is opiates. Well, opiate is a CNS. It works on the central nervous system. And what it does is actually it slows down your ability to breathe. It slows down your heart rate. It slows down your breathing. And so it may cause accidental suicide if you are using opiates and you start having symptoms of the coronavirus.
Interesting. So there's a whole lot of reasons to be really cautious about what you're using right now because it could actually create another health issue for you related to the COVID-19 world. That's very interesting. Very, very interesting. So if you're just joining us, you're watching Health Healing Everyday Life Problems in a COVID-19 world. And tonight we're talking about substance abuse. We have Dr. Tran and Dr. Oneill here on the line. If you have questions, put them in the chat box. We definitely will answer them. This is such an important topic to discuss for so many reasons. It's one that I don't think we talk about enough. And so I'm glad that the two of you are here this evening. One thing I want to kind of shift to is the differences between, because lay people will say, you know, he's an alcoholic or he's an addict, and they use those words without completely understanding the clinical ness behind it. So can you I'll share the differences between what we know are dependence and abuse. How do you know what's the point when you know you really got a problem, where you really need to seek some help? And what are the things folks need to look out for in knowing the differences between those? Dr. Oneill, you can go ahead and start.
Okay, sure. So what we call it actually a disorder. More than anything. I mean, that's the technical term. I don't really get too caught up on labels. And so I think about things as, is it a problem? Is it not a problem? And then I look at things like, which of course is part of the diagnostic piece. Is this something that you're continuing to do despite consequences? Are you able to stop? Is this something that you're giving up other parts of your life? I mean, the diagnostic manual talks about all of these aspects to it. Are you building tolerance? Do you withdraw? And what's funny is some people will say, well, I don't withdraw from it, so I'm not addicted. Well, that mixing that up, that's physical dependence. So physical dependence, for example, if you use opiates for like 8 days, and I may be off a day or two, your body develops a physical dependence. That doesn't mean you're an addiction, addicted to it. It doesn't mean that you have a disorder. It means you have a physical dependence on it. There's a difference. Okay. So I think we can get lost sometimes in the titles, get lost in the alcoholism or addiction or disorder. We need to look at the impact on that person and that person's family and their system. We need to look at consequences they're struggling with. We need to look at what they're facing. For example, If someone comes to see me for an evaluation and they say, I've had three DUIs, they'll say, do you think I have a problem? I'll be like, yes. And they'll be like, what are you basing it on? You have 3 DUIs. See, because the vast majority of people who have a DUI don't get a second DUI. You know why they don't get a second DUI? Because they change their behavior.
Yeah.
They alter it. They can handle things differently. Now, maybe some of those people still have a problem, but it's not the same. It's the person who gets that second and that third. So the consequences and an inability to change. And when someone says to you, well, I can stop anytime I want to, and you say, well, you lost your job, you lost your wife, you lost your dog, you're a bad country song. So that was funny. They were bad country.
It was funny.
Anyway, just nobody laughed. I was like, wait a minute, that was kind of funny, right? Your wife, your dog,
I'm with
anyway, and you've lost all these things and you haven't changed, you haven't stopped. Well, that's an indication that physically, mentally, emotionally, you're not able to. Right? I mean, because I'm assuming those were important things to you. Having a job, having an income, having a relationship, your dog Fido, all those things are important. So we look at all of those factors and then we determine, hey, look, this is a disorder. This is more than just a casual issue that happens every once in a while.
Got you. That is important to understand. The effect it has on you, your world, your life, all of those things are indicators that there is a problem that needs to be addressed. Now, Dr. Tran, from the council's perspective and the folks that you guys typically see, is that, so for the work that you do there, if someone hasn't had major loss, right, the world isn't completely upside down like Dr. Oneill just described, but they don't want to drink as much as they do, or they don't want to use as much as they do, is that still an appropriate time to seek the services of the facilities of like what you guys offer?
Absolutely. Now, there are different levels of substance use, right? Actually, at the council and at most other places, try to start off with prevention. Before kids and people even start using, we want to teach them about substances and the helpful effects of different substances as well as the harmful effects. So before people even use. And as they progress through experimentation and then use and then abuse and then dependence, those criteria tells us how much services or the severity of the services that we should offer for people. So if a 14-year-old is going to a party and they smoked weed and drank a beer for the first time, went home, went to sleep, and they woke up, went back to school again, they probably just need some education. I'm not going to send them to a 28-day residential rehab. That's probably not going to happen. Right? And so the intensity of need is based on the intensity of use. As Dr. Oneill said, well, if someone's been using, physically addicted, and they've lost their wife, and they've lost their house, and they've lost everything, even if they don't know that they have a problem, obviously these major changes to their life, these major losses, calls for a higher level of service. And so depending on where you are, based on the psychosocial assessment, we will send you, or we will refer you, or we will treat you based on what you share with us and what the severity is.
Got you. Okay, so it definitely depends. So you show up and your assessment will determine what services you stand in need of. I love prevention. I'm all about prevention, right? I feel like if we can prevent an issue from happening, that makes less, you have less negative repercussions from that, because you may have what you call experimented, but you get educated and you can prevent it from becoming a problem, right? So that becomes really important. And so initially though, in my head, people would think prevention is just for young people, because they're young and they don't know the difference. But I see that both of you are shaking your head like, no, adults can use prevention too, correct?
That's what we're doing now.
Yeah. We're
doing preventative medicine right now.
Yeah.
We're talking about things that maybe somebody goes home after this, or they're already home, sorry. Somebody goes from one room to the other and they take their medications and they put them somewhere else. Yep. Or maybe someone goes, maybe I should take a day off from drinking. Or as one of the questions is asking, maybe I should come up with some additional coping skills. Maybe I need to find different ways to manage my stress. Maybe I need to come up with a new plan, a new approach and everything.
Exactly.
So prevention is lifelong, man. And it's something I have to say, I'm a huge fan of the council. And I'll tell you why. The council offers, I don't work for the council, I'm just a huge fan of the council, because they offer the whole gamut. They offer everything. And they're a lifeline in the community for people struggling and wondering if they're struggling. Not just that they know for a fact, they're wondering. And what the council does beautifully is they assess people in a way that's, I think, respectful and humanistic, and doesn't just, I think, throw people into treatment. I mean, the fear that a lot of people have is that if they reach out for help, someone's going to say you need 90 days of rehab.
Got you, right.
And that's not the case. It's they look at motivation, they look at supports, they look at environment. You look at the whole package and you say, you know, I think an outpatient program would work well for you, or I think a counselor, or, you know, I'm worried about some of the mental health stuff. So maybe seeing a psychiatrist and a counselor, you adapt it based on the needs of the person. It's not like a Hollywood movie with Sandra Bullock or something. 90 days of treatment. Right. I mean, that's not how it works. And so having a lifeline in the community like the council is a blessing for the Houston area. I can tell you that some communities just don't have it. And they have people who really suffer greatly because they don't have the ability to get the help when they need it.
Got you. That's a great point. That's a really great point. And I'm glad you brought that up, because I'm wondering, Dr. Tran, are the types of services that the council offers, and I know you guys are here, are there sister organizations that you guys have information to if someone is watching, they live somewhere else, that they could, you know, I don't know, is there a national database of places like the council in different places for folks to access?
Well, the one rule we have at the council is that we turn no one away. No matter where you're calling from, no matter who you are. And we have a limited number of services, right? But we turn no one away. And the only reason we're able to do that is because we network with different agencies. I got an email earlier today from Austin, from the States, sharing what treatment centers were available. You know, having a large network is very, very helpful. And so I have counselors at different hospitals like HCPC. We work with the Harris Center. We work with all kinds of different agencies. And so one of the great things about being the counselor and being here for so long is that we've been able to reach out and work with all different treatment centers and clinicians. We still want to reach out more, though. And so obviously, if you have beds available, if you have a clinician available, if you have expertise available, like Dr. Oneill, you want to come in, you want to share, you want to teach, you want to provide services, our doors are always open, and we're always looking to learn and grow, just like everyone else here.
And to make connections. So what is, and I'm going to start scrolling some of y'all's contact information here at the bottom. So if folks need to get in contact, they have questions, what number would folks call Dr. Tran for the council if they need help or they have questions?
Right now, I would recommend going to the councilontherecovery.org. That's probably and going down and looking at some of the services we have available. That's probably the best way to do it right now, because we have so many online and virtual support programs available right now. You can find our 888 contact number available right now on there. And so that's where you're going to get the largest amount of information. But obviously, you can always call our 800 number and reach one of our master's level clinicians, and you will also be routed that way.
Got you. Okay. All right. So, Dr. Oneill, I want to talk about the Menninger Clinic and the kinds of services that they offer. I know you are in the outpatient facility now, but Menninger is definitely an inpatient psychiatric hospital as well. What does that look like? Somebody's watching, they have no clue, you know, what they need. But if inpatient was needed, what does it look like? What does that treatment entail?
Well, the most important thing to understand is that everybody that needs it would get an intake, would have a screening, discuss the level of services. Very few people actually need to go into the psychiatric hospital in terms of the number of calls that people have. So a lot of people are looking at what other services are available, whether it's the outpatient services, which I manage, I'm the clinical leader for that, or it's a partial hospitalization, things along those lines. One of the big things that we do is we do an enormous amount of family work. We don't just treat the one person, we treat the family. And I know the council does a wonderful job of that with Lori Feaster and other people involved in their programs. And so I think you have to go into it understanding that this is not a single person issue. And so if they wanted to and needed to, we could treat the entire family. And that's a huge part of it.
That's important, because a lot of folks aren't coming into it thinking that. They're saying This is the person with the problem. You fix them. I mean, that's just therapy in general, right? They're coming to me for that, for not for substance abuse, but for other stuff. And as opposed to the unit being treated, speak to the value of that, because I don't know that folks really understand that the unit can be treated even if there's one person presenting with one of the symptoms of the greater issue. Can you speak to what
Sure.
that's like and why that's helpful?
You can't drop somebody off and expect that they're going to get sober.
Mm.
You can't just do a drive-through and say, you are the problem, you go get sober. It's the whole family that has to understand what it means to be in recovery. And the whole family has a part. They have a role. And they also have pain and agony that they need to work on and deal with and cope with. And if you don't address that, so you have a sober person in a home that's not sober, or you have a person in recovery in a home that's still struggling and in pain with resentment, and anger, and all the emotions that come along with it. And so having a family service, a family program allows people to sort through that and to talk about it and to understand what to expect. I mean, you have to understand what can I expect? And how do I talk about it when I'm feeling a certain way? Just because someone stops using a substance doesn't mean everything's okay. I mean, that literally is a Hollywood movie.
Yeah, right.
I just stop and I'm good. Right. No, the stopping of the substance is wonderful. It's important. It's life-saving, but it's all the other stuff that comes along with that that's critical as well. It's like, how do we heal? How do we recover as a unit, as a family system? And so that's our philosophy. I told you at the beginning, I'm an attachment guy. So I really look at how relationships heal and grow and people attach and reattach. And in an addicted system or in a system with substance use, the attachments are disordered. I did my dissertation on that. So attachment systems completely are destroyed, and you have to heal those systems.
God, that's so powerful, because folks don't think that way in many cases. You think this is the kid with the problem, this is the wife with the problem, this is the husband with the problem, but it really is our system problem that we can really all play a part in the recovery from, which is more helpful. And I love what you said. You said you stop somebody from using a substance because they stop doesn't mean all your problems go away. And sometimes people probably think you dry up the well, everything is good. Well, what we didn't get into today, we won't have time, is that substance abuse or any, comes from a place, right? There's something that can be a source. And so if we don't find a way to deal with some of those, what I call critical mass, kind of the bottom foundational things, then just removing one thing doesn't solve the problem. There's still some greater stuff that has to be addressed. So the website for the Menninger Clinic is menningerclinic.org. Okay, I thought that. I just wanted to make sure. So I have that here too. So if you're watching this replay or even live, and you have someone in your world, or maybe it's you and you're struggling and you're wanting to get information about how you can get some help or what you can do, these are two amazing resources that are in the Houston greater area. But one of the things that I know for sure is you can reach out to either of them, no matter where you live, to gain some additional information. Folks, I know I used to work at the Menninger Clinic years and years and years. I think we decided it was 17 years ago, I think, some long time ago. And so people from all over the world come there if they need the inpatient kind of treatment. But you are able to get resources. You just need to ask for them. I think one of the worst things that can happen is that folks sit home right now and suffer, thinking that they don't have any options, that they have no recourse, and that they have to continue to live inside of whatever emotional distress they're in, and there's nothing they can do about it. So the answer to that is absolutely not. You don't have to just sit inside of it. You have options, and there are things you can do to help yourself. So Dr. Oneill, we're on our last few minutes here. If there was one message you wanted to send to folks today, something you wanted somebody who's watching to know for sure, if they didn't hear anything else you said, they missed the whole hour conversation, they just popped in, like they just tuned in, what do you want them to know? What do you want them to think about?
That's a pretty tough ask.
That's a good one.
Right. Well, I think we need to be kind to ourselves at this point. I think we need to take care of ourselves. I think we need to pay attention to how we're feeling and how we're doing. We need to be real with that. Because right now it's easy. Whoa, we're moving all around. It's like, whoa. it's like 4 squares moving around. Yeah. Anyway, so we have to really pay attention to what's going on in our head and our heart, and ask for help. You said it nicely. Reach out. Don't be scared. Don't let shame. Don't let stigma. Don't let the fear of rejection or the fear of being locked away or whatever it is stop you from reaching for help. The only way we're going to, any of us, ever get better is by raising our hand and saying, I need something. I need help. I need guidance. There's a lot of caring people out there in the community that are available. Just seek them out.
Absolutely. Absolutely. Thank you for that. Dr. Tran, one thing, if folks are just tuning in, the one thing you want folks to know, they don't remember anything else that we talked about. What is something you want folks to be thinking about right now as it relates to our topic tonight?
You are not alone. I think that's the biggest message I can share, right? You're not the only person experiencing isolation. You're not the only person experiencing COVID-19. You're not the only person that is using alcohol, that is being anxious, that is sad, that is depressed. And so one thing that we need to do is we need to reach out, right? We need to reach out because you are not alone, and you're feeling this alone. It's not good, right? So if I'm feeling alone and you're feeling alone, Dr. Shane, and you're feeling alone, Dr. Oneill, maybe we can reach out to each other just like this, and we will no longer be alone, and we can get the services and the help and the support that we need.
Excellent, excellent, excellent. Well, thank you two so much for this conversation. Y'all have wowed the audience because they have had no questions. Y'all have answered every possible question they could have had, apparently. So if this has been helpful to you, I know there are those of you out there watching, just give these men folk, which we called them earlier, a thumbs up. Let us know that this was something that resonated with you. It was information that was worth hearing and listening to. It's something we don't talk about enough. And I'm just grateful that we were able to have this conversation tonight. We're in a COVID-19 world, but we don't have to do this thing alone. And in using healthy coping mechanisms and learning other coping strategies is critical to getting through this time. So remember to access the resources that are scrolling at the bottom of the screen if you are in need of any kind of help. Thank you, Dr. Oneill, for being here this evening. Thank you, Dr. Tran. He had already popped off. Appreciate you so much for being here tonight. And I will bring Dr. Rochelle Whitaker back up and we will close us out. I just can't believe we've done this for 5 days. That was a good conversation, was it not?
It was.
I learned some things. Listen, I'm on my way to my cabinet right now to get rid of my opioids and all of the things that could be problematic. Right. I'm not having folks show up here and go through my little closet of medication.
I hadn't even thought about that, but that is one of the things that has stuck out in my mind. I'm like, I need to do the same thing. Go to my cabinet and take that stuff out. I'm like, you know, how many parents are sitting on medication and it does not register? It didn't register for us. So how many other does it not register for? So
no.
That's kind of scary.
Yeah. I mean, we have young children, so we think it's not an issue, but you heard Dr. Oneill mention his youngest client he's treated was 12 years old. So we're talking about young. My kid is 13. So at the point that they become aware is at the point when you don't need to have it accessible. Exactly. So we're there now. And it could not just be them. It could be other people that come into your home. You just never know. That was mind blowing. That was great stuff. So, I mean, Dr. Whitaker, what do we say? We're on day 5. We've done this for 5 days. We've talked about a whole bunch of stuff. Let's give them a quick recap of where we've been this week if they've missed us any day.
Yeah, so day 1, we talked with Dr. Brown about domestic violence. Day 2, we talked with some more men folk about mental illness in men. Day 3, we talked with Dr. Robinson about depression, anxiety, and grief, which, you know, people are experiencing in droves right now. And then last night we talked about the family, how all COVID-19 is affecting the family. And we round out the night with substance abuse. So we have this week, these experts have covered a multitude of topics that are affecting us right now.
And you know what, Dr. Whitaker, I just realized that we have one question that was in the feed that we didn't answer. Dr. Oneill, can I bring you back on to answer this question, please? Okay, all right. I just ran into it. I'm not sure how I missed it earlier. So the question is, I'm gonna pop it on the screen so we can see it. When someone has the urge to drink alcohol or use drugs, what would you suggest for them as another positive coping mechanism to do instead of turning to the bottle?
Mm-hmm. That's a great question. And it really depends on that person. And I think people have to take, when I work with clients, when we put together a recovery plan, we do an inventory of all the things that they used to enjoy, all the things that they might enjoy, all the things that they might be enjoying now, which is usually not a whole lot because alcohol has kind of taken over. And so you have to do an inventory of what are some of the things that I really want to do. Okay. So I've had clients that learned how to cook, or clients that joined a running club, or clients that said, I'm going to learn a new language or whatever. You have to come up with something that's unique for you, that takes up your time, that occupies space, that brings you some joy. Because at the end of the day, if I say go read a book, that isn't going to work. That might bring you joy, but that's not going to be as effective. And that's the other thing to keep in mind. It's not about finding something that's one for one effective. Okay. Very few things are going to be one for one effective when it comes to drinking a bottle of wine. You drink a bottle of wine, lights out for most people, right? A bottle of wine. So you have to put that in context, that it's about coming up with a variety of things, multiple options. Hey, you know what? Walking my dog feels pretty good. It's not the same as drinking a bottle of wine, but that feels good. Hey, you know what? Connecting with someone and having a movie night feels pretty good. And so coming up with 3, 4, 5 different things that you can do that maybe you used to like, or maybe you've always wanted to do, and putting together your plan and trying them. Because what a lot of people will do is they'll try it and they'll go, that's not very good. Right. Well, no, it takes time for your brain to rewire and for your brain to get to a place where it believes that it can help you. Gotcha. And so give it time and be patient with those changes. Got you. Hopefully that helped you. That was a great answer. Thank you for popping back on to answer it. And thank you for asking that question, Rochelle. I'm sure you're not alone in wondering what are the alternatives. So that was a great answer for how to think about that. So, I mean, I just feel like this week has been really awesome. If you've been here all 5 days, just put in the chat 5 days, all week. I've been here, and so many of you have been here all week. And we just say thank you for choosing to spend an hour in your evenings with us here in this mental health virtual summit. This is year number 2. We actually did this last year. I want to say we did it for less days. It wasn't quite 5 days. Right.
No, we did it. I think it was maybe like three or 4 days.
3 or 4 days. But so much was going on this year. We were like, we just got to extend it a little bit just to make sure that we're able to cover enough topics for folks who may be suffering. So if this was helpful to you, just let us know. We will have other things available to you. These are all available for CEUs. If you are a clinician after tonight's live feed, you will receive an email that you can complete a CEU questionnaire, and then you can get CEUs for $5. If you are registered, you will be able to get that link. If you have not registered, you can still go to the link and register and make sure you get that as well, to make sure you get your CEUs. Also, this will be something that will be available as a package at a later point. If anyone would like to just have the entire 5 segments all in one, we'll be sending emails out about how you can access all of that as well. But I just want to say thank you to all of our presenters. They're not all here tonight, but I want to thank them for being here, as well as you, because without an audience, who are we talking to? So thank you guys for being here. Any closing words, Dr. Whitaker?
I would just like to say, if you know that someone is struggling with any of these issues that we presented on, know that you are not alone and help is available. And so I just co-sign with what Dr. Tran said, that help is available. So seek out help and or reach out to us, and we can help you, help direct you to, the people that can help you. So just know that you are not alone.
And just know, just from this 5 days, these are just folks who we know that we just asked. So if you got questions and you need some specific kind of help, I trust and believe if we don't know them, we know somebody who does, and we'll be asking those questions. We got some 5-dayers in here, all 5 days. Great information. Help. We got 5 days. We got some folks who need some help with the CEU link. We got you. We're gonna correct all of those things tonight. All right, thank you guys for being here. So this is where we sign off. We wish you guys a safe rest beginning to the summer. Here we go, and we'll see you guys next time. So just stay tuned. Beacon Institute got more things that we're going to share with you. Y'all have a great evening. Bye, everybody.
Stay safe.